I recently read that 70% of all pressure ulcers occur in older adults. And this is a particular concern given the changes that occur in our skin as we age and the increased susceptibility to skin infection and disease. Dr. Fleming, a geriatrician and the medical director for the Mayflower and the Gardens at Depew Nursing Center, is here to educate me on wound care. Welcome. And welcome to you, Dr. Fleming.
Glad to be here, Serena.
And I want to know about these pressure ulcers. What does the term mean, and why do they occur?
Well, ulcer is a term for skin breakdown or pressure sores, they can be called. And they're very common in elderly people that are debilitated or bedridden or for some reason have reduced awareness and can't shift their position. You and I sitting here, we unconsciously move.
Yes.
And avoid pressure over a bony prominence for a period of time. It surprisingly doesn't take very long for the skin to start to be damaged by that. And elderly people who are impaired can't necessarily deal with it, and their skin is at risk.
Now, are pressure ulcers the only type of wound that older adults get?
No, there's also wounds caused by vascular problems, such as arterial poor flow to the legs or feet, venous problems with swelling and edema due to varicose veins and those kinds of things. And then diabetics or other people with neuropathy can have skin breakdown because they can't feel a pebble in their shoe or a tack on the floor, and so that leads to damage.
Okay, let's say I have a wound or a sore. What might be a barrier to healing?
Probably the main thing is avoiding the continued pressure. So the first step in any of these situations in the pressure sores is to offload, is to change position frequently and avoid the continued pressure over the bony prominence, which leads to the breakdown.
Okay, but now, are there some chronic wounds that a person might have?
Yes, this can get very challenging. Chronic wounds can be covered with a scab or an eschar that would require debridement, for example. They can get secondarily infected. In the case of venous problems in the legs, edema is a major issue and has to be dealt with by like compression stockings and elevation and other ways to get rid of fluid so that the circulation can improve.
Now, as a physician, would you treat a new wound in a different way from the way you treat an old wound?
Well, it depends on the staging of the wound and on the location of the wound and the nature of it. You know, this is actually a medical field in itself, and there are specialists in wound care, nurses and physicians. So it depends on the wound, but yes, the general answer is yes, because chronic wounds can be a real challenging issue.
Okay, now just tell me, what are some of the things that I can do to prevent pressure ulcers, skin tags, and so forth?
If you mean skin tears, those are very common in institutionalized elderlies like nursing homes because the skin is very frail, it's fragile, they reach out, they bump things like furniture and wheelchairs, and their skin is easily lacerated. But in general, same things we've talked about many times before is good behavioral health practices. As far as the skin, moisturizing lotions are good. Anything to avoid against dehydration, which is a risk factor, and just staying well in general.
Okay, now let's say I get a blister on my heel. What is the best thing for me to do?
Well, number one, avoid whatever caused it in the first place, which
throw
is
away those shoes.
An ill-fitting shoe or something of that nature. But in general, keep it covered and keep it clean. And if you avoid the pressure, it will heal on its own.
I certainly do thank you for being here and giving me some tips on this. And yes, I will get out the moisturizing lotion.
Sure.
Thank you, Dr. Fleming. Well, Dr. Fleming has been giving us some helpful hints on preventing and treating wounds.